And
okay, it's telling me that we are live, but unfortunately, I'm still seeing.
let me see if I can see you on my phone being live.
It's just weird because, oh, there we go. Okay, we're live now. There we go. Technology. So, ladies and gentlemen, good afternoon. So glad that you could join us after my marathon 3-hour dog chasing in Cherokee Park with a successful capture. We're very grateful for that. With us today, we have some experts in the medical field, and I'm just going to let them introduce themselves. Jared and I are going to be asking questions to try to give you guys some clarity about what you need to do during this extraordinary public health crisis. And it will be on speaker view. So Catherine Harrison Turner, we're going to start with you, ma'am.
Well, I'm very flattered that you would call me an expert at anything. I cannot claim to be a medical expert, but I do work with quite a few medical experts and listen to them and work with them, hear them talk every day when it comes to the public health of our city. But I am the communications director for the Louisville Metro Department of Public Health and Wellness.
Yeah.
And we have been working on the COVID response for a long time now. You all know, you've experienced it with us.
We have, and we appreciate all your hard work and the work of all of the medical personnel and experts that are associated with Louisville Public Health and Wellness. Dr. Shaw.
Thank you, Tara, for having me on the show. So I'm Karan Shah. I'm the VP for Physician Integration at Baptist Health Louisville. I also serve as the Systems Physician Advisor for Baptist Health. So I'm glad to be here and happy to answer any questions that you have to the best of my ability.
We appreciate that. Julie?
Oh, I'm Julie Garrison. I'm the Director of Marketing and Public Relations at Baptist Health. But I'll defer probably all the questions to Dr. Shaw.
That's okay, because we need to hear from the medical experts. So one of the first things that needs to be said is we have a lot of tools that are available to us right now that we did not have 2 years ago. We have the ability to get vaccinations. We have the ability to get boosters. We have the ability to test much more frequently through PCR and rapid testing. We still have masking, we still have social distancing, but our world has obviously turned back to much more normalcy than we experienced during the first major shutdown, and that's something that everyone is trying to avoid happening again. The issue is with the constantly evolving variants of the coronavirus, we keep encountering new, more dastardly, more tricky variants that somehow creep into our lives no matter what we do, no matter what barriers we put up. And unfortunately, we have not caught up with the brilliance of this virus. And I've heard it said so many times that it is a very smart virus. So if we could, Kathy, just talk to us briefly about what Louisville Public Health and Wellness has done and what has been set up for our use to try to keep us healthy and to try to keep us from spreading the virus.
Yeah, so your local health department does a lot of things. We have disease investigators who work to try to stop the spread of disease. We work to put together public-private partnerships. So for instance, right now, we have many partners who are providing testing. So there are at least 20, I think, different testing sites or providers listed on our website. And most recently, I think people may be familiar that we worked with Blue Water Labs to stand up a mass testing site at Churchill Downs. We've worked with all of our health system partners. They are crucial partners in this effort. We've all worked to share facts and information and data. You know, we've put up a data dashboard on the city's website. So at any time, anyone can go and see how much COVID is in our city, how many deaths, how many people are vaccinated, the demographics of people who are getting sick, the demographics of people who are being vaccinated. We have just a whole source of information there. We also have a COVID helpline. That's a Lou Health COVID helpline, which is 502-912-8598. that anyone can call. If you are sick and you don't know what to do, you've tested positive, you're not sure what to do, you are isolating at home and you realize I have no food, I have no over-the-counter medicine, you know, you can call that number. We can help you. If you need a ride to a testing appointment or a ride to get vaccinated, we can help you. We can help you find testing locations, and we can help you find vaccination locations. You know, it's just very comprehensive what we've done. We've worked hard to try to make sure that testing and vaccinations are made available to everyone across the city so that everyone has access. And again, working with all of you all, our 502 live stream partners, our healthcare system partners, experts like Dr. Shaw, who are more than willing to talk about and share firsthand the facts, what we're seeing in the city with regards to COVID, what we're seeing with regards to patients in our hospitals, and what we can all do to protect ourselves.
Give me that number one more time.
502-912-8598.
Very important that we
That
have
is
that.
the Lou Health COVID Helpline. So, if, you know, like I said, if somebody needs to find a place to get tested, they need find a place to get vaccinated. I think the key piece is that essential needs piece. A lot of people don't know, you know, I'm at home, I'm sick. I think you were telling me about a friend who's alone at home, can't really get out. They might need groceries. They might need some over-the-counter medicine. Maybe they need some prescription medicine picked up. Maybe they need pet food.
That's
because
right.
they can't get out and get it. They can call that helpline number, and we have a whole system in place where we can help them with that.
Excellent. Excellent. Just for a quick second, if you wouldn't mind, Julie Garrison, just talk to us for a second about the overwhelming demand on our hospital systems that you are experiencing at Baptist personally.
So I think that, you know, all of our hospitals across the state of Kentucky and, you know, Floyd and Southern Indiana, we've all seen a rise in cases, of course. But we have a you know, a large system. And so we all work together you know, to care for our patients as best we can. So I'm going to kind of let Dr. Shaw tell us about what he is seeing, because he's closer to the action than I am.
Absolutely. And I've got a lot of medical questions, and I know that Jared does too. So Dr. Shaw, let's talk to you just for a minute. You must be exhausted, first of all. Describe what it's like to be a doctor in a pandemic, especially one of this proportion.
So, I mean, it is definitely, you're right. You know, it is tiring. You know, I really hope that folks that are listening to this do the right thing, right? Which is sort of get the vaccine, you know, wear your mask when you're outside, get the booster if you're eligible, because it is important, right? And it does save lives. And if you do test positive, please quarantine, right? I mean, it's sort of easy to say, hey, this is over, but it's not, right? We're still sort of in the midst of it. And, you know, I mean, this is real, and we are seeing a lot of things sort of, you know, that we've never seen in our lifetimes. And most of us, hopefully, will never see it again.
That's what we hope. And it just seems like it's a never ending story, you know, because I know that the numbers have been phenomenal. And as you as a physician are working to help people who are dealing with COVID, you are also having to prioritize care for people who have car accidents, heart attacks, cancer treatments, all the things that normally we would be serving the public doing. And then to have the COVID dropped on top of that has been what has brought many hospital systems to the tipping point.
So Tara, that's a great point, right? And I want to sort of say that to the public or whoever's listening, that, you know, a lot of folks, what they've done is, because of the COVID pandemic, have sort of avoided the preventative care, right? They're sort of saying, hey, not now. But it is important, right? I mean, there are ways to sort of get that done. And it is important that people continue doing that, especially through telehealth visits that we have across the system. There's also, you know, outside of virtual visits, there are urgent care. So I would really encourage folks to continue getting those preventative care so that it's not too late and it doesn't become an emergency by the time we see folks or I see folks in the emergency room.
One of the frightening things to me, just based upon personal experience, is I had COVID last week. I was lucky to get the Omicron virus. I never thought I'd hear anybody say that, but I'm so grateful I didn't get the coronavirus that came out at the beginning. I didn't get the Delta. You know, I've been very, very cautious about masking. I've been, you know, extraordinarily careful about social distancing, sanitizing to the greatest degree possible. But I also work in media, so I'm exposed constantly to large groups of people. And now that it's become so contagious, I think we've got to get people to understand the point is it's not that you are so healthy that you don't need the virus. There's a purpose in getting the maximum number of people vaccinated. Can you explain that to us in language that we can understand at a 6th grade level?
Yeah, absolutely. So the truth of the matter is, right, I mean, it's not that the vaccine is going to completely prevent disease, right? What the vaccine does is that it prevents severe disease, right? And we knew that from the start. And I think that is the most important sort of message in all of this, right? Is that, you know, just because let's take flu vaccine, for example, right? We sort of guess what the flu virus is going to look like every year, and the vaccine's made. That doesn't necessarily mean that you're not going to get the flu, right? People will still get the flu, same way, right? People will still get the COVID virus, but if you're vaccinated, your immune system has a way to sort of say that they have photocopies, right, of the antibodies that can sort of get activated when the body sees the virus. And I think that's really the reason why people should get vaccinated, so that the immune system doesn't go haywire and go completely crazy. And what we see are the post-COVID syndromes and, you know, people that are sick and in the ICU when they're completely not vaccinated.
So when we go back to the issue of getting people the right kind of help, we're being told not to go to the emergency rooms for testing. Another complication arose today with a severe cold that some of the testing sites that are just partners of the health department, the health department doesn't control them. And I want to take that monkey off of Kathy's back, because it's not like you guys have control over what these testing sites do. Explain how you partner with them and what has happened with their staffing today, particularly.
So thanks, Tara. So today in particular, I think it was a combination, and probably largely because of just the extreme cold. It was really impossible to have employees out at these drive-through sites outside. I think they were having issues with things freezing as far as like trying to collect some of the specimens or some of the stuff that they used. And it was just really too harsh. It was harsh conditions. And then on top of that, many of our testing partners are like the rest of us, businesses. I'm sure maybe Baptist is experiencing this as well, but our employees aren't immune to getting sick as well, right? Or being exposed. And then to be safe, they need to quarantine or isolate. So they also may be facing some challenges with regard to staffing. And so we would just ask people to please, I know your patience is stretched thin. I know people are really, tired of all of this, but just if you do need testing, please don't go to an emergency room, and do try to visit a testing site, but have some patience. They may have to delay. They may have to cut back. They may not be able to open. On our city website, if you go to louisvilleky.gov, we have a COVID-19 resource center, and you can click on the testing page. And for many of the testing sites that we have for the general public, we'll link you to their website, or we'll have a phone number. And maybe before you go out, if you need to be testing, you try to call to make sure that they're open and operating. But we know testing is super important. We want people to get tested, but just understand right now, it's just kind of this crazy mix of things, right? Severe cold and winter. A lot of people in our community who are sick or exposed to COVID and having to isolate, and that places challenges across the board for all of us, all businesses, really everyone.
Dr. Shaw, talk to us a little bit about testing as far as the difference between a rapid test and the gold standard PCR test, and also the fact that in my own personal experience, during the time I was positive by PCR, I was getting negative rapid test results every day, which concerned me. And I understand from the other health experts that I've been listening to that this particular variant, the Omicron variant, is not as good at picking up this particular, on these particular rapid tests. Some of them are better than others. Just talk to us a bit about the difference in testing.
Yeah, so the easiest way, Tara, I can describe the two tests is the antigen test, you need a high viral count, right? So until your body's making enough viral particles, the antigen test might still be negative. So it could be what we call essentially a false negative, right? On the other hand, what a PCR test or an RT-PCR test does, which we call the gold standard, is even if there's a small amount of viral particle, we replicate it to millions of copies and then see if somebody's positive or negative. So that means that the RT-PCR test is just much more sensitive in picking up any viral particles. And that's why, you could, like you're saying, you could be negative on the antigen test, but when you get the RT-PCR test, you might turn out positive. So that being said, even if your antigen test is negative and you have symptoms, anything that sort of relates to COVID, runny nose, sore throat, it's very important that you isolate, wear a mask and stay away from others so that you're not exposing others to the virus.
I've found that with my particular case, I thought I had a urinary tract infection and I was starting to develop my typical January sinus infection. So I made the assumption, even though I've been tested weekly since testing became available, I made the assumption that it could indeed be COVID. But I'm hearing from so many people that there are many, many different symptoms and they are not the normal ones. They are not the normal ones. So just talk to us a bit about the difference, okay?
Yeah. So the real question is, what is normal at this point, right? I mean, in terms of COVID, the reality is, like you said, right? And this is sort of where there are differences, right? Every person, honestly has a different symptom, right? So, we know the generic ones, right? Hey, if you have a runny nose, you have a cough, you have a sore throat, you have a headache, you have body aches, right? Maybe some GI symptoms that could be COVID, right? But, we're honestly seeing, symptoms, folks that are coming up, especially the extremes of age, where older folks might just come in with a little bit of chest pain or passing out. Like in your case, Tara, you thought you had a UTI, right? We're seeing folks that are coming with other symptoms that end up being positive for COVID. So I really think, if you're not feeling 100%, I would recommend that you at least quarantine or think about quarantining, and at least considering that you might have COVID. That's probably the best way.
Yeah, that's the most important key, is just to assume that you have COVID, follow the CDC guidelines to isolate and quarantine and protect others from that spread. Summer Dickerson, one of our 502 live streamers, went to the hospital last night with stabbing pains in her side. She spent 14 hours, not at Baptist, 14 hours, and did not get any results. And because there were so many actual emergencies happening in the emergency room, she ended up leaving after being there at noon. She left at 2 a.m. because they took her off the waiting list, which, made no sense to me. But she's still sick. She still hasn't gotten a PCR. She still hasn't gotten treatment for whatever is actually ailing her. And I think that when we call it a public health crisis, it's gone past the point of just being a normal public health crisis. It's an absolute, ending of all times public health crisis in comparison to what we've ever seen before. So is there some sort of prioritization that's going on in the ERs so that what people are trying to figure out is, okay, I feel like I'm having a heart attack. I go to the hospital. I sit in an emergency room with a bunch of people with COVID, and I'm not being seen. What are the priorities that are taking place in an emergency room so that people know when they should go to the emergency room or when they should rely on the immediate care centers or contacting a primary care physician? Just reflect on that for a moment.
Yeah, so Tara, what I'll say is, right, the emergency room, regardless of COVID or not, right, always had a priority system sort of in place, right? And we sort of prioritize patients depending on how sick folks are. And one of the ways we use it is we use the vital signs, right? Which is sort of, hey, is your heart rate greater than 100, right? Is your respiratory rate above 18, right? Are you breathing very fast? Do you have a fever, right? Is your blood pressure less than 120 over 80, right? Or it's super high. What's going on? So we've always had a priority sort of system in place. And I really think, I mean, we're trying, it is a public health crisis. And like you said, maybe a little bit more than that. But what I would encourage folks is, if you feel okay and you feel like, hey, this is not, obviously, if there's an emergency, come to the ED, right? I mean, I want everybody to hear that loud and clear, that if that's what our purpose is. Our purpose is to take care of the very sick folks. But if you feel that, you can wait or you can talk, I mean, there's also telehealth visits that you can get on and see a provider. You can also obviously go to urgent cares and immediate care centers, which is also a possibility. And if you're not sure, right, and you're walking and you can walk somewhere, I mean, start with an urgent care, right? I mean, there is a provider that will see you. And then if they feel that there's an issue, then they can always essentially send you. I mean, people can also go to baptisthealth.com. We offer e-visits 24/7, and a care finder will help you find a convenient care option. So if you're not even sure, just call or just go to baptisthealth.com and do the e-visit, and we can always direct you to the appropriate level of care.
That's excellent. And Julie's mentioning in the chat, I saw it flash up there and I couldn't see it. So Julie, please tell us what you said just now. At Baptist Hospitals, you offer what?
It's actually Dr. Shaw read that. So I don't know if your viewers can see the chat, but if they didn't have time to write down the address, baptisthealth.com is our website. And again, on the homepage, you can link right to a virtual visit, or if you're not exactly sure, there is a little bit of a quiz you can walk through to help you find like the best level of care and a convenient location near you. I also will put in the chat too, if you need a booster or you need a vaccine still, ages 12 and up are eligible for boosters, and we're offering those at our drive-through vaccine clinic at the hospital at 4000 Crisi Way. So I'm happy to put that in there as well. We are open on certain days and times, Tuesdays, Wednesdays, Fridays, and Saturdays from 8 a.m. to 2:30 p.m. Again, you don't necessarily have to have an appointment. You can make an appointment. I would recommend making an appointment with the weather. We had a situation a couple of weeks ago where the temperatures dropped and the computers wouldn't work outside well. So we had to close early one day and open late another day. So we try to post that as soon as we can. But again, if you go to scheduleyourvaccine.com, you can, see what sites. And we have vaccine clinics still at Baptist Health Hardin if you're in the Elizabethtown area, or at Baptist Health Louisville. So again, like Dr. Shaw said, the boosters, they make a difference, and the vaccine makes a difference if you've been on the fence. So again, like I said, we're doing that for ages 12 and up. 12 to 15-year-olds need to have a parent or a legal guardian with them. But all that is explained on scheduleyourvaccine.com.
Okay, I've got that
thank
running
you.
across the bottom of the screen so that people can see that, because that's a very important thing to add. Jared?
Tara, can I add something with that to
Please,
piggyback
Kathy.
on what she
Yeah.
said?
Mhm.
So we often share, usually we try to share weekly, a look at our COVID cases, hospitalizations, ICU, and deaths in the vaccinated versus the unvaccinated. And just again, to speak to that point, this is looking across all of our hospital systems in Jefferson County. And from March 1st through, I have information through January 15th, 77% of Louisville's cases have been in people who are unvaccinated. Right now, 76% of people in the hospital, since the beginning of time, they have been unvaccinated. From March 1st to January 15th, the ICU, 78% have been unvaccinated. And in our deaths from March 1st through January 15th, March 1st to January 15th, 76% have been in the unvaccinated.
That's an important thing to know, because a lot of people were saying, oh no, there's vaccinated people in the hospital too. That goes against everything, flies in the face of everything that we've all been saying, which is if you get vaccinated, you are much less likely to end up deathly ill or in the hospital. Who wants to respond to that? Dr. Shaw?
I mean, that's been proven again and again in every sort of research paper that's come out, is that the vaccine prevents severe disease and death. And I can't express that anymore. I mean, I'm happy to share any papers, anything that, but I mean, from a scientific community, I mean, that's what we're seeing, right? And the other thing that I'll extend to folks, I mean, people are on the fence sort of saying, hey, maybe the vaccine's not safe or anything like that, right? I mean, at this point, there are so many vaccines we've given out worldwide. I mean, not only just the United States, that they are relatively safe, right? I mean, they're made with the mRNA technology, which is just a piece of mRNA, right? I mean, it can't mutate the genetic makeup. It can't do anything at all. It's just a piece of mRNA that is injected and gives your body, your immune system, a chance to make antibodies. So when the virus comes in, they know exactly what to do with the virus instead of going haywire.
So one question that just popped up is, we were talking about the priority system. How does that priority system in the ER for treatment work for people that don't have typical vital signs, like those with tachycardia or who run low BP or temperatures on a regular basis?
Terry, will you ask me that question again? I just want to make sure I understand it.
Yeah, basically she's saying if you're going into the hospital and you are not normal, basically like I have very low blood pressure. It's like 90/50. If you have a tachycardia, if you have some sort of temperature that runs at 94 or 99, how do they prioritize you for care in the emergency room if you are not one of those typical people who are showing symptoms?
Sure. So one of the ways is, right, I mean, you're still getting triaged, where the process is, most likely in most EDs, usually it's a nurse that will triage you. So somebody's still laying eyes on you and seeing, what do you look like, right? And they triage. I mean, a lot of folks, usually it's the most experienced folks that are triaging. So they have the experience to say, oh, this person does look sick, right? There's something wrong about the story. We need to prioritize this patient. We need to bring them back. And if there's always any question at all, they always reach out to the provider that's sort of working in the back, or the number of providers that are in the back, to say, hey, something's wrong. Can you please come out and see the patient?
Talk to us a little bit, and Julie, feel free to pop in here, about staffing issues at hospitals, the reduction in nursing care, the nurses who have left the profession due to the stresses of the last 2 years, and what's being done. Because I know that Kentucky Nurses Association's Delano Manson has had such an impact that the governor did a live stream about the fact that they're working to encourage people to join the nursing profession. So feel free to jump in there, any of you guys.
So I'll say this. I know at Baptist Health Louisville and Baptist Health across the system, we are managing, and we are, we've sort of encouraged our own labor force to say, hey, you know what, we want to recognize them for the hard work that they're doing. And we've sort of encouraged them to, through helping hand, sort of bonus, essentially, if you want to call it that. But, we recognize the hard work that the nurses are doing. And that has sort of really helped us manage our labor pool.
Kathy, did you want to throw in on that?
Me?
I
Kathy or Julie?
Or Julie?
So, yeah, I would just add, I think that in talking to, leaders, and what we talk about on a daily basis is how can we support all of our staff? Because, it not only do they have challenges during their workday, they also have to deal with, all of the challenges that everyone else has at home, with, their kids being sick, or daycares being closed, or school going remote. So it's not just the heavy load that they carry at work. It's also the stresses that they face, at home, and then the challenges of them getting sick. So, we try to communicate a lot of different resources. Our chaplains have been amazing to help, talk to staff. We have, a lot of different resources out there that we've tried to, make sure that staff knows is available. And then when you talk about, nurses leaving the workforce, it was really cool this past year for a lot of our retired nurses to come back to help in the vaccine clinic. So that's been kind of a different twist. That's people who have retired who come back. And then just within the last month, a lot of our retired leaders, nurses, leaders from all over who have retired, in the last year to probably the last 20 years, they all raised money and delivered goodie bags to all of the units and departments across the hospital, even our support departments, with all kinds of snacks and care items and things like that. So just to let everyone know that, they're very appreciated, and to kind of give them that little extra dose of help and compassion. So, there's just been a lot, but I know that the staff would appreciate, the community, thanking them and caring for them. I mean, I've heard from several nurses that, in the beginning we were heroes, and we just don't feel like that anymore. There's so much negativity. So I think the most that we can do is support our healthcare workers who are working tirelessly still.
Absolutely. Kathy, do you want to add on to that?
No, I mean, I have heard that as well from even the Kentucky Nurses Association, that nurses were heroes, healthcare heroes, and now they're afraid to go to the grocery store in their scrubs because of some negativity that they're getting. Or in the hospital, they ask someone to put on a mask for their protection and that person's, and they want to just verbally berate them. So I don't know about you all, but if I have to be in the hospital, I sure do want a nurse, who I want a great nurse. I mean, I want a nurse. Typically, nurses are so caring and compassionate and experts in what they do, and I want a happy nurse looking after me. So I think anything that we can do to let all of our healthcare professionals know, that we appreciate them so much. And I think a great way of doing that is try to stay out of the hospital and the urgent treatment center. Wear your mask. People want to say, no, there's research that shows that masking doesn't work. I beg to differ. There is an abundance of research now that shows we can prevent infections. We can reduce the viral load that they get by wearing a mask. Or even better, keep out of the emergency room as much as you can by getting vaccinated and boosted. Just something simple. Who wants to go to the emergency room, right? Only if you're really sick and you need that help. So do your best to stay out by getting vaccinated. Wear your mask. Get your kids vaccinated.
I think I'm a prime example of how masking actually works, because when COVID broke out, I remember a couple of local officials gave me an N95 mask and said, put this on and keep it on. And I was out covering COVID. I was out covering the protests. I was in massive groups of unmasked people. We didn't have vaccines. I kept that mask on as much as I possibly could. And I did not, and I have a complete immunocompromise. I have, something called CVID, combined variable immune deficiency, and it was a miracle that I didn't get sick. But I was really, really absolute about masking and sanitizing and as much social distancing as possible in a protest crowd. But I think that one of the things that people are not realizing is that we were outdoors. And so there was some sort of built-in help there. When people are going to parties, people are going to weddings and funerals and going into packed restaurants and bars and unmasking so they can eat and drink, we're not doing what we can to prevent the spread of a very contagious variant. So, we can address that because we all are talking about not wanting to shut down. But if we don't stop the things that we're doing, it seems like it's headed in that direction.
Well, to your point, it's like a chain reaction. it's not that there have to be mandates to shut us down. The virus is basically shutting us down, right?
Right.
So the virus is now making so many people sick that they're having to cut their business hours, or they can't open because they don't have staff. And so we have to realize sort of the chain effect that it has, that, okay, you go to this big indoor concert or whatever, and you don't wear your mask, or, you know, and then maybe you get exposed, and then who knows, like, who else gets exposed? And so then that means somebody's maybe taking it home and their kids are sick. So now the kids can't go to daycare, but they need the kids to go, and they can't go to work because now they all have to quarantine or isolate. Not to mention, you know, let's hope nobody gets severely ill. But it all sort of has this chain reaction. We're all connected, right? People don't want to hear that we're all in this together, but we really are. And because the virus doesn't move, people move, and people transmit the virus. And the more people that we're around and we're not protected, that's how it's spreading. And please, Dr. Shaw, correct me if I have said anything wrong.
You're right. I mean, it's an exponential spread, right? I mean, sort of, yeah, and that's why it spreads so rapidly, right? Because it goes, you know, it's sort of the log tables that we once learned back in high school. You know, sort of this exponential spread. So and the more people you get in contact with, the more chances it is that, you know, it's going to spread exponentially.
So one of
You
the
know, I want to
go ahead, Kath.
No, I was just going to say, and maybe Dr. Shaw can also help me with this. You know, earlier you were talking about, people will say, well, I know people who are vaccinated who are getting sick. And so these COVID vaccines, I think Dr. Shaw said, it's not absolute, but here's some, I'm trying to draw a comparison. So all of us get in our car and we put on our seatbelts, and we don't think anything about that because that's normative, right? That's what we all do. And a seatbelt is not going to guarantee that you don't get in an accident. And it's not going to guarantee that you might not sustain an injury, but it don't. Information out.
Yep, we're back. Go ahead. Continue.
So what I'll say, right, is that it's sort of the way the human immune system works, right? It's sort of when it sees a new virus, right, which COVID-19 is, right? I mean, the immune system just doesn't know whether this is Ebola or this is COVID-19, right? I mean, what kind of virus it is. And I think that's where the immune system sort of goes haywire, crazy, trying to get rid of the virus, get rid of the virus. And I think that's where the vaccine comes in and helps, right? Because if you've had the vaccine, now your body is made what we call antibodies to that virus. So it knows that it has that library of antibodies and says, oh, I've seen this before, right? I mean, that's the best way to put it. And then it's saying, okay, I know exactly what to mobilize in this particular situation. So I don't need to go crazy and overboard that we see when folks are non-vaccinated and get super sick.
Excellent information. I appreciate that so much. So we are at a point where we really have to consider, as our parents did and our grandparents did before us, whether what we're doing is for the good of ourselves or for the good of others, for the good of our families, for the good of our nation. You know, my parents put on uniforms, enlisted in the Navy, and served in World War II without a second thought. So did all of my other relatives. There have been a lot of people who've gone into the military and served because they knew they needed to. So many in helping professions, doctors, nurses, law enforcement, you know, people who do things to help others do it without thinking, is this good for me? And I think we need to talk about the buy-in that we have to get from people to understand that we're not just doing this for ourselves.
I mean, I think that just was like what I was trying to say a little while ago. Really, we can make decisions just for ourselves, but often what we do will definitely have an impact on others. I mean, and particularly with a virus that's highly infectious, it's just not just about you. The action and choices that you make every day, they're probably affecting someone. It may affect your spouse, your children, your partner, your coworkers, but we are all in this together. And I think we've even seen with this virus as a world how interconnected we are. It didn't take very long from the first case that was in China made it to Louisville because we're so globally connected. We have an international airport here.
So, Dr. Shaw, I'm going to come back to you with this next question. We're now hearing about flu Rona and Deltacron, and something that's coming out of, I think, Cyprus maybe, and then France, another variant called IMU or IHU, as I recall. Talk to us a little bit about how long it takes, as Kathy just said, for something to be discovered in another corner of the world and for it to show up here.
Like Kathy's saying, right, we're so interconnected that it's tough to tell, right? The world with airplanes, with air travel, right? It's a matter of time, honestly, is what it is. And we knew this even when the first COVID-19 variant came out, right? That RNA viruses, which this is, mutate, right? RNA is not as stable as DNA. So we were expecting that, hey, there will be other strains coming out. And I think that's why it goes back to, right? If you are vaccinated, you're less likely to spread the virus because you'll probably make less copies of the virus. And the chances of sort of new variants coming out are also lower. So I know, I sound like a broken record when I keep saying get vaccinated, but there's so many important factors in this that the vaccine can really help mitigate. And this is truly a public health tool that we have, right? When I think about healthcare and the difference that we've made in human lifespan, right? The two big things are vaccines and antibiotics. And there's a reason why vaccines are in there. It's because they really help.
And one of the things the federal government has touted is that 75% of adults making their own medical decisions, 18 and over, are now vaccinated. It's the other 25% that they're concerned about.
Correct, absolutely. And I hope that whoever's not vaccinated will sort of think about this and hopefully is listening and say, hey, it is time, right? There's enough data. It is safe. It will, if it doesn't protect your life, it will protect somebody else's life that's around you. And we're, I know you guys said this earlier, both Kathy and Tara, that we're in this together, right? The virus doesn't see, what religion a person is, what your political beliefs are, nothing that, right? At the end of the day, we're all in this together and we're interconnected, and people should get vaccinated.
Let me ask you a question, Doctor. You wear a mask, don't you?
Absolutely.
How many hours a day do you think you wear a mask?
So I have a 2-year-old, and I'll tell you, and the reason I sort of bring him up is because he's seen me with the mask even at home, and now he will basically, if he sees me without a mask, he will sort of go up and pull my mask up and say, hey, put a mask up. So, that being said, I am masked a whole lot. The only reason I'm not masked right now is because I'm alone sitting in my office. But if I'm around somebody, I'm going to put that mask on.
Yeah, that's a major thing, because a lot of people who are saying that masks cause carbon monoxide and dioxide and all kinds of other things to build up, and that you have trouble breathing. I wore a mask 24/7 for 10 days just to protect my dogs, and I still gave 2 of my 3 dogs COVID.
Yeah.
Which is pretty terrifying, and I feel really responsible for their sneezing and weeping eyes. But fortunately, I've been told by my veterinary experts that self-resolves. I think that's another important point to bring up, though, right now, is that it is possible to give your pets COVID. And Kathy, we've talked about this a lot because, our Louisville Zoo animals came down with COVID, especially the big cats. And it's very easy to transmit it to our animals, and we have to use extra caution and treat them as we do other family members if we are positive in the household.
Treat them as you do other family members, ma'am.
Yeah.
All the time.
Yep.
That's why I had to turn my camera off earlier, because my little Yorkie was coming in making noise like, it's time to eat. It's time to eat. So sorry about that earlier.
That's okay. My 3 are all sitting here shaking their collars and asking for dinner as well. Julie, let's come back to you for just a second, if you don't mind. We can see those little things that you put up in the chat, but they're abrogated, they're real short, and they have a ... after them. So if you will send me that information, I will post it in the string of all of the pages that this live stream is covering right now, and that way we can send that information forward.
Oh, sure, absolutely.
Sounds good. So I'm going to have you, doctor, wrap up for us, if you will, real quick here. Just tell us, we're feeling sick. We're not sure what's wrong. We have to assume that it is COVID. What steps should we take next to get medical assistance?
I think if you're not short of breath or you're not, feeling like you can't get enough air or can't breathe, I think the first step I would do is I'd probably do a virtual visit and say, where should I go? Start there if you can. Obviously, if you feel short of breath, you have chest pain, anything that is worrisome, you should go to the emergency department.
Okay. Second step, we are not having shortness of breath. We're not having chest pain. What do?
I would still recommend, obviously, self-isolate. If you are around family members, wear the mask, ask your family to wear a mask, right? Because like you guys said, right, I mean, it spreads even to the dogs, right? I mean, so definitely isolate, and then I would start with the virtual visit. And if you have a home antigen test, I mean, try it, start there.
Kathy, COVID Helpline is up. What other services are being offered? I've got that already on the screen. What are the other services being offered by the Louisville Public Health and Wellness?
Again, if you go to louisvilleky.gov, you can find testing locations. You can find our helpline number. I mean, really call that for anything. You can find vaccination locations. There are several places where we, the public health department, are offering community vaccine clinics. We're usually kind of in the same place 1 day a week, every week with hours, and you can find them on there. And of course, our healthcare system providers are also offering vaccinations. We've got a lot of resources for people at louisvilleky.gov, or call the Lou Health Helpline. You've tested positive, you're not sure what to do, call the helpline, 502-912-8598.
And there are many, many testing sites that are available. And if you schedule a week in advance as a proactive measure, it's called prophylactic for a reason. If you schedule in advance, then you will have a test scheduled. And right now, that's probably the better part of valor. And that's what I've been doing all year, is just scheduling a week in advance so I could be assured of being able to get a test instead of waiting till I thought I had it and then trying to get a test. So, that's my suggestion. Julie, you want to wrap up with any final thoughts?
No, we just really, really appreciate you, Tara, getting the word out. And again, our job at Baptist Health, and really all the hospitals around the community, all the medical care providers, it's to get people well and to make them healthier. So anytime that we can help educate and get people to the right level of care, and again, don't hesitate to seek care for sure, but there's, if you need help, we're here.
I think you were one of the fine physicians and physicians people and medical staff who were with me when testing first came out, and people were so afraid to get tested. And someone at the top of our federal government talked about how painful it was to have a swab stuck up his nose. And I came over to Baptist. You guys gave me a test and let me live stream it. It was not sent in because the mediums were so rare at that time. It was very, very hard to get a hold of tests. But you did the process. You let me live stream it, show people how simple it was, and then talk to us about the excellent work that you were doing. And I just want to thank you for that and for giving me the opportunity to amplify your message as well. So thank you, Julie.
You're welcome. Thank you.
Kathy, thank you so much for everything you do. We appreciate you. And what else can we do to support you at Public Health?
Well, you are supporting us. Thank you so much for how you are just committed to sharing facts and information. And then I just wanted to put in one more plug for our testing providers and our healthcare providers. It's a difficult time for everyone. It's really challenging. Please just operate with kindness, try to have compassion and patience. It will make you feel better, I believe.
It absolutely will. And Dr. Shaw, any last thoughts?
The only thing I'll say is if you know a nurse, if you know a physician, please thank them for what they do. It will honestly make their week, their month, probably even the year that they're appreciated.
Thank you, Dr. Shaw. Dr. Karan Shaw and Kathy Turner, Louisville Public Health and Wellness, and Julie Garrison from Baptist Hospital, Baptist Health, I should say. We really appreciate you guys. Thank you so much for taking the time and for sharing your expertise. And I will call on you again, I promise you. And we will disseminate this information until our own last breaths, because, if we don't take care of each other, we can't expect anyone else to take care of us. So thank you all so much.
Thank you.
Have a good night.